Welcome to this tutorial on clinical enzymology brought to you by Medical Biochemistry Power Capsule series. This video covers the following CBME curriculum topics in addition to other salient points. This video is preceded by tutorial to A, to B and to C. We therefore suggest that you may go through those tutorials available in this series. Enzymes, the molecular workhorses of biological systems, are not just biochemical entities confined to the realms of cellular metabolism. In the context of medical science, they serve as invaluable tools for diagnosis, prognosis, and monitoring of various diseases. Enzymes are also useful as therapeutic agents. Furthermore, enzymes are widely used for various diagnostic and analytical procedures in laboratories. This mnemonic given below will help you remember the points. Enzymes have utility in diagnosing diseases. Cellular enzymes typically stay within cells where they function. However, they may be released into the bloodstream during cellular turnover and then cleared from the body. In healthy individuals, enzyme levels in the bloodstream are low. Diseases or pathological conditions can elevate these levels due to factors like increased membrane permeability and tissue necrosis releasing intracellular enzymes. Metabolic stress can also raise enzyme levels, possibly due to temporary membrane permeability changes. Hence, measurement of enzyme level in blood and body fluids can aid in diagnosing clinical conditions. Enzymes wield immense diagnostic power owing to their tissue-specific distribution and release patterns in response to cellular injury or dysfunction. Elevated serum levels of certain enzymes serve as telltale signs of organ damage or disease. These enzymes are typically released into the bloodstream when there is damage or dysfunction in specific organs or tissues. The specificity and sensitivity of these enzyme markers empower clinicians to identify the underlying pathology, facilitating timely intervention and management strategies. Serum enzymes, therefore, serve as valuable markers of pathological conditions by indicating tissue or organ damage. Given here is an indicative list of enzymes that have diagnostic significance including ST, LT, gamma-glutamyl transferase and others. The list of such enzymes is long and as you go on you shall come across many such enzyme markers used for diagnosing a host of disease conditions. And we have some more common enzyme markers in this list. It's important to know that apart from the few enzymes mentioned in this list, there's a long list of enzymes that have utility as markers of disease conditions. As you continue your studies, you shall gradually come to know about those, and providing an exhaustive list would have been superfluous at this stage. Enzymes can be used to determine prognosis. Beyond diagnosis, enzymes, as prognostic indicators, offer prognostic insights into disease progression and patient outcomes. The magnitude of enzyme elevation often correlates with the severity of tissue damage or disease. For instance, in myocardial infarction, the extent of CPKMB elevation correlates with the size of the infarct and predicts the risk of adverse cardiac events. Similarly, in liver diseases, the ratio of ST to LT levels, ST-LT ratio, provides prognostic information, with higher ratios indicative of advanced fibrosis or cirrhosis. These prognostic markers guide clinicians in risk stratification, treatment planning, and patient counseling, with the objective of ultimately improving clinical outcomes. Enzymes can also be used for disease monitoring. Enzymes play a pivotal role in therapeutic monitoring, facilitating the assessment of treatment efficacy and disease progression. Serial measurements of enzyme levels enable clinicians to gauge the response to therapeutic interventions and adjust treatment regimens accordingly. For instance, in patients with chronic hepatitis C undergoing antiviral therapy, monitoring changes in serum ALT levels helps assess treatment response and guide therapy duration. Similarly, in pancreatic diseases, monitoring of amylase and lipase levels aids in evaluating the response to medical or surgical interventions, guiding further management decisions. There usually is a strong correlation between serum amylase and lipase level, and the seriousness of the disease condition. However, the utility of enzyme markers is not without challenges. Variability in enzyme levels due to factors like age, gender, ethnicity, and comorbidities necessitates careful interpretation of results. Furthermore, the lack of specificity of some enzyme markers warrants the use of comprehensive diagnostic panels and imaging modalities for accurate disease characterization. Enzymes have plenty of therapeutic roles. In fact, they are life-saving medicines in many circumstances. Enzymes have therapeutic applications too. Enzyme replacement therapy is one such. Deficiencies in certain enzymes can lead to genetic disorders known as enzyme deficiencies. Enzyme replacement therapy involves administering exogenous enzymes to individuals lacking specific enzymes, effectively managing conditions like Gaucher's disease, Fabry disease, and lysosomal storage disorders. In this box given alongside, names of some genetic enzyme-related disorders have been depicted along with the enzymes that are administered. Such diseases are of course not very common. Enzyme supplements are commonly used to aid digestion in individuals with pancreatic insufficiency, cystic fibrosis, or other digestive disorders. These supplements contain enzymes like amylase, lipase, and protease to assist in the breakdown of carbohydrates, fats, and proteins, respectively. Enzymes are widely used in thrombolytic therapy. Enzymes such as tissue plasminogen activator are used therapeutically to dissolve blood clots in conditions like acute myocardial infarction, ischemic stroke, and pulmonary embolism. TPA works by converting plasminogen into plasmin, which degrades fibrin, the protein meshwork of blood clots. Inhibition of specific enzymes is a key strategy in pharmacotherapy. Drugs that inhibit enzymes involved in pathological processes can be used to treat various conditions. For example, inhibitors of angiotensin-converting enzyme are used to manage hypertension and heart failure by preventing the conversion of angiotensin 1 to angiotensin 2, a potent vasoconstrictor. Many useful pharmaceutical compounds are actually enzyme inhibitors, and this list given alongside displays the names of few such molecules used. Enzymes have various uses in clinical as well as in research laboratories. Enzymes serve as indispensable laboratory reagents and play a pivotal role in enzyme-based clinical laboratory assays. Their catalytic properties, specificity, and versatility make them invaluable tools for biochemical, immunochemical, and molecular diagnostic applications, enabling sensitive, specific, and efficient detection of biomarkers and measurement of analytes in diverse biological samples. Enzymes serve as crucial laboratory reagents and play a central role in enzyme-based assays in the clinical laboratory. Enzymes are important as laboratory reagents. In laboratory settings, enzymes catalyze specific reactions, facilitating the production of desired compounds or the detection of specific analytes. Enzymes exhibit remarkable specificity for their substrates, enabling precise control over the reactions they catalyze. This specificity is exploited in laboratory assays to selectively target and detect particular molecules or analytes. The versatility of enzymes can be employed in a variety of biochemical assays, some of which have been depicted in the box here. Enzymes are used in immunoassays, enzyme-linked immunosorbent assays, and related immunoassays utilize enzymes as labels to detect the presence and quantify the concentration of antibodies, antigens, hormones, and other biomolecules in biological samples. Enzyme labels, such as horseradish peroxidase or alkaline phosphatase, generate detectable signals upon substrate conversion, enabling sensitive and specific detection of target analytes. Various types of immunoassays have been developed and names of few such methods have been depicted here in the box. Enzymes play a pivotal role in molecular diagnostic techniques such as polymerase chain reaction, reverse transcription PCR, and nucleic acid sequencing. DNA polymerase S, RNA polymerase S, and various nucleases, are essential enzymes used in these assays to amplify, transcribe, or cleave nucleic acid sequences, enabling the detection and characterization of genetic variants, pathogens, and gene expression profiles. Enzymes are used for enzyme activity assay, which is an indispensable technique for measurement of enzyme levels in serum and fluids. Enzyme activity assays measure the activity of specific enzymes in biological samples, providing insights into cellular function, metabolic pathways, and disease states. These assays often involve monitoring changes in substrate or product concentrations, enzyme kinetics, or signal generation through enzyme-substrate interactions. In this box here, we have mentioned about some of the common enzymes for which activity assays are routinely performed on biological samples. The serum levels of the enzymes named here serve as critical markers of various disorders commonly encountered in clinical practice. In this presentation, we have deliberately refrained from providing an exhaustive exploration of the diverse applications of enzymes, spanning from their utilization in disease diagnosis to laboratory settings. Such comprehensive discussions are reserved for their respective chapters, where you will delve into elaborate details. For instance, the chapter on liver function tests will comprehensively cover liver enzymes, while the chapter on cardiac markers will have a detailed account on cardiac enzymes. Similarly, you will be able to know more about therapeutic uses of enzymes in chapters on specific diseases. Our primary aim here has been to introduce you to the multifaceted utility of enzymes. In conclusion, clinical enzymology stands at the forefront of modern medicine, offering a nuanced understanding of disease pathophysiology and guiding clinical decision-making. From diagnosis to prognosis and therapeutic monitoring, enzymes serve as indispensable tools in the armamentarium of healthcare providers. As research continues to unravel the intricate roles of enzymes in health and disease, their clinical utility is poised to further evolve, ushering in an era of precision medicine and personalized patient care.
Thanks for watching this video. Our next tutorial in the Medical Biochemistry Power Capsule series is titled Carbohydrates, Classification and Functions. The tutorials presented in the MBPC series are not intended to be a substitute for your textbooks. However, we feel that these tutorials can prove to be very valuable as complementary educational aids and for purpose of rapid revision prior to exams. If you enjoyed this video, don't forget to hit the like button, subscribe for more exciting content, and share with your friends. And do keep watching our channel to remain ahead in the game.